Hello, Mr. Alatorre. This is Katy Kauffman, and I'm going to be giving my demonstration speech. I'm from ASU Beebe. Hello, everyone. My name is Katy Kauffman, and I'm going to show you all how to take blood pressure. To begin, I want to make sure everyone knows that this is a blood pressure cuff. This is what I'll be using today. This is the face of the blood pressure cuff. This is where you're going to actually see the numbers during the reading, and this is where you inflate the cuff. To make this as easy as possible, I wanted to break it down into 5 easy steps. The first step I want to tell you is to put the blood pressure cuff on your patient's arm. You want to make sure it's above the elbow, and there's going to be a patch on the blood pressure cuff that says artery, and that's where you want to put it on the inside of the elbow over the brachial artery. If it's not in the right place, you might get an inaccurate reading, so you want to make sure this is in the right place. The second part I want to tell you is to put the stethoscope on your ears. You're going to put this end of the stethoscope in your ears, and you're going to put the flat part of the stethoscope to the brachial artery. You need to hold it down tightly, and again, make sure it's directly over the brachial artery, because if it's not, you might not be able to hear it right, or you could get an inaccurate reading. The third thing you want to do is you want to inflate the cuff. You're going to pump up the cuff with the cuff pumper that I told you about earlier. You're going to pump it up until the needle on the face reaches about to the number 180. Sometimes you need to go higher, sometimes you need to go lower, depending on the patient. But usually it's about 180. Make sure you pump it all the way up to 180, and then when you get done that, step 4 happens. You want to make sure and release the valve. The valve, you want to release counterclockwise until you can hear the air slowly escaping from the blood pressure cuff. This is the hardest part, the 5th step. You want to make sure you can listen and watch the face at the same time. You're going to have to kind of multitask. Once you start deflating the cuff, you're going to hear a swoosh. After you hear the swoosh, you'll start hearing thumps. In the first thump, you want to make sure you remember where the needle was and what number it was on, because that's what the number that you're going to have to remember. Keep listening for thumps. As soon as the last thump is done, you want to remember where the needle was at that thump also. So say that you inflated the cuff, you heard the swoosh at maybe 160, and then at 150 you heard the first thump. I remember 150, I keep hearing thumps until about 80. I remember 80, and my blood pressure is 150 over 80. Now to show you especially, I'm going to do it on Brittany. She's my guinea pig. So my first step is to put it on her arm. I'm going to fit it snugly, and the patch that says artery is right over the brachial artery. I'm going to put the stethoscope in my ear, and I'm going to put the flat part of the stethoscope over her brachial artery. The third step, I inflate the cuff all the way up to 180. I release the valve. I heard the swoosh. There's the first thump at 80, and the last thump is at 60. So I would say that Brittany's blood pressure is 80 over 60.